DJ Welfare. Say all that. Till you so. No pressure. See, this no be politics, so. But we decided to compare the health manifestos of the two largest political parties in Ghana, NPP and NDC. You know, say as youth in the country, we should be interested in the future of the healthcare sector in Ghana. And so we decided to dissect the manifestos of both parties, focusing on the health. We want to understand the plans they have for our healthcare, you and I. So stay with me as we dichotomize the health manifestos of NPP and NDC. I'll compare the manifestos of both parties based on 5 main themes. But before that, I want us to look at the goals and vision of both parties. Let's start with the new Patriotic Party. Rado. The NPP focuses on consolidating and improving existing healthcare infrastructures and initiatives. But particularly, they emphasize on expanding access to quality healthcare, especially under the NHIS. You know, they are very popular on that one. But NPP also aim to expand digital health services, increase efficiency, and build more regional hospitals. Let's look at the National Democratic Congress. NDC's vision centers on health for all, by all, and in all. It sounds like democracy, government for the people, by the people, and for the people. They call them NDC, National Democratic Congress. But this vision, it focuses on localizing healthcare, expanding primary and specialized services, and introducing innovative funding schemes to make healthcare more sustainable. I'll take you through the new funding care that they have, which is called the M-Care, as we move on in this video. So stay with me. But you realize that both parties are emphasizing improving access to healthcare, which is something that I was proud about. Both of them want to create more access to healthcare, and it's not too different from what Express Med is doing anyway. So they are kind of in line with what we are doing. And they also want to emphasize quality of service delivery. And so these are the directions that we should look out for. We hear people complain about delivery, mother and child health care, ward, shortage of beds at major hospitals. And so these are things that both parties are looking forward to invest in. But let's go into detail and hear what they have. The first comparison is based on disease prevention and health promotion. But let me draw your mind to something. Every information out there is not from my mind, it's from the manifestos of both parties, which can be found online on their own website. And so try to look at this video and join me in having a discussion from a non-political lens. Okay, let's have an open-minded discussion on this. So let's go into details about disease prevention and health promotion. What does the NPP have to say? Kukrudu. Hey. They want to focus on expanding Agenda 111. Remember Agenda 111? Agenda 111 project to build hospitals and increase healthcare access, particularly in underserved areas. The second thing is they are committed to improving sanitation to fight preventable diseases like cholera and malaria, continuing immunization programs. Already see the way cholera they affect people for the Galamsey site. In case you missed that video, you can check it out in our previous post where we went into detail on how cholera is really deteriorating the lives of people in Galamsey mining areas. But let's come back to NDC. Concerning disease prevention and health promotion, NDC plans to introduce initiatives like the Food for Health. And this program is to educate the public on nutrition and promote indigenous foods. They also proposed a National Vector Control Program, MVCP, And this is aimed at eliminating malaria as well as regular cancer screening initiative. This might be what? Children's cancer. Hope you are looking up for your child. In case you missed that video, you want to check that out as well. The second thematic area for analysis and comparison is mental health. And indeed, I was happy to see that both parties recognize the need for more investment in mental health programs and expansion of the psychiatric centers. Let's start with NDC. NDC's approach to mental health includes building a new mental health hospital in the northern sector of Ghana, and refurbishing existing ones like Accra and Pantai Psychiatric Hospital. NDC also proposed integrating mental health care into primary health services and introducing hotlines under the NHIS for mental health support. So if you get any mental health issue, you will feel call. But do not wait until 2025 after election is over. Mental health is an important issue. If you ever feel the need to check your mental health status or assess yourself, visit a psychiatric hospital, talk to a psychologist, or download the ExpressMed Ghana app. And as always, our psychologists are always available to help you. Let's look at NPP. NPP aims to integrate mental health services into the mainstream healthcare system with a focus on providing resources for mental health within existing hospitals. So already the established hospitals, they will try inculcate mental health services into these existing services. NPP also plans to scale up community mental health services and improve conditions at psychiatric hospitals. But if you watch inside that, both of them have similar plans for mental health, which at the end of the day, the CC will benefit you and me all. So we too, before try, take care of one ourselves. Let's look at the third comparison, and this is based on health infrastructure development. Infrastructure, let's start with NPP. The Agenda 111 is still central on their manifesto. If they not finish, we don't say they're not finished, but they say they come up, they will try complete. And so they aim to build 111, I don't know how they come up with 111 anyway, but they want to build 111 hospitals across the country, including regional and district hospitals. NPP also emphasized the expansion of digital health services with a focus on telemedicine. We all know digitalization. NDC, they also plan to complete abandoned health projects and upgrade existing hospitals, such as the Kolebu Teaching Hospital and the Ridge Hospital. I think Mahama really did well to revamp the Ridge Hospital. They also intend to localize healthcare through expanding the chip compounds, reintroducing mobile health services, and establishing satellite clinics in schools. Both of them spoke about telemedicine and the importance of digitalization. And I want us to look at this. We are moving into a digitalized world, and technology is really changing everything around us. It is important that we now start thinking of how we can access healthcare digitally. You do not always need to necessarily walk to a hospital to see a doctor. For some of these issues, you can have a conversation with the same doctor on phone, via video, text, or audio. Easy. You can, as always, use the ExpressMed Ghana app. You can download it on Google Play Store or iOS, and then 24/7 you can talk to a doctor online. So Charlie, before starting use the telemedicine services before these parties even come to power. Let's look at the next thematic area of analysis. This is equally important. You say money, they do everything, and so both parties want to focus on healthcare funding and financing. There are a lot of health issues in this country that if we had the right financial investment, we would have resolved them. Let's start with NDC again. NDC proposes establishing what they call Ghana Medical Care Trust Fund, MCare. Some people call it Mahama Care, like the way we have Obama Care. So what's the purpose of the MCare? To support chronic conditions like cancer, kidney, and then heart diseases. NDC also suggests diversifying health financing by dedicating part of the national revenue from the extractive sector to health funding. NPP, on the other hand, they aim to strengthen the National Health Insurance Scheme, NHIS, by increasing its funding and efficiency. So they want to pump more money into the NHIS so that the scheme can pay service providers for the services provided to Ghanaians. NPP also seek to create an NHIS card linked to the biometric system to improve access and then reduce fraud. Bamia is trying to link the NHIS card and the Ghana card together with other cards like BVLA and then other ID cards.
Digitalization.
So, the last thing, which is equally important, is the pharmaceutical and medical tourism. Both parties are trying to be innovative here to invest in medical tourism, to make Ghana a hub for medical innovation and then pharmaceutical production. It's important that we try to do more localization. We start producing more medicines, more vaccines in the country. And so it's a good direction that both parties want to get into. What does NPP have to say concerning pharmaceutical and medical tourism? They aim to improve local production, as I mentioned, of pharmaceuticals, including PPE, protective equipment, and essential medicines. NPP is also working to make Ghana a hub for medical research and innovation, and then attract investment into the healthcare sector. We seriously need investment in Ghana's healthcare sector. Equipment, machines, services, the personnel, the people. NDC wants to establish a national bioequivalence center and pharmaceutical research. Bioequivalence, and then Pharmaceutical Research Institute to promote research-backed development of herbal and alternative medicines. Recently, in the NHIS says they want to add herbal medicines into the NHIS system. We have a post on that coming up shortly, so if you haven't subscribed yet, subscribe and click on the notification button so that you'll be the first to know when that post is up and running. NDC is also planning to position Ghana as a medical tourism hub by upgrading selected hospitals to meet international standards. And so, like I said, both parties are looking forward to invest in the healthcare sector to make Ghana a tourism hub and also more innovative in terms of research, vaccines, and medicines. Before I wrap up, let me leave you with two key areas that both parties touched on. The first is human resource development and welfare. And here, both parties are interested in the well-being and welfare of the healthcare workers. And NPP, for instance, want to recruit more doctors, nurses, and healthcare professionals. This is in the NDC Manifesto as well. They also want to offer incentives to healthcare workers. NDC also want to increase the remuneration for healthcare workers. But NPP particularly has something here. You need to see this. Special focus on incentives for rural and deprived areas and a car purchasing plan for healthcare workers. When this thing came on social media, a lot of people say, Bamia said he's going to buy a car for all the healthcare workers. It's about a car purchasing scheme for healthcare workers. NDC also wants to address shortages in the health among health workers by expanding training and improving their welfare, especially in rural areas. NDC also wants to provide incentives and career development opportunities. The last one, and I'm happy that they didn't leave this important bracket of the society out, people with disabilities, PWDs. And so they have a thing called special care and inclusion. NDC is focusing on maternal and child health, enhancing healthcare for vulnerable groups, including children, women, and the elderly. They are also going to introduce specialized health programs for people with disabilities and improve their access to services. It's important that we give equal access and opportunities with PWDs. They are part of us. And then they also plan to expand healthcare access for marginalized communities and special needs populations. NPP, on the other hand, they also have a plan of improving maternal health, elderly care or geriatric services, and healthcare for people with disabilities. And they plan on expanding geriatric and establishing home care and rehabilitation special services. Expressmen, you already know, we provide one of the best nursing home care services for Ghana. And so, if a family member of yours, be it your uncle, dad, or an elderly who is sick and needs care at home, contact Expressmed and our medical team, our doctors, our nurses, physiotherapists, and even our mobile lab team can attend to you wherever you are in Ghana. So guys, NPP NDC Manifesto on health. There you have it. You've heard from me what both parties have in stock for us when they come to power 2025. But my advice be say it be simple election as we dey go vote, make you no go fight. Then the Makidis no go come fight too. So you to make your mind dey, just go and vote and come home and listen to the results. Whichever party comes to power, take your health, make it dey your own hands inside. Look after yourself, exercise regularly, eat good food, and also try to use some of the digital technologies like our telemedicine platform. And stay healthy, guys. Thanks for watching. If you have any comments or if I missed anything in the manifesto, do well to share with me and let's discuss.
That'll be all.
Bye, guys. Peace.